Wait, before you take your next sip of coffee, you need to hear this. What if your daily cup contains natural compounds that can influence your blood sugar, insulin sensitivity, and metabolic health in ways similar to some diabetes drugs? And what if, without realizing it, you're either helping your body heal or making your glucose control worse? Right now, millions of people are living with prediabetes or type 2 diabetes, trying to manage numbers with diet changes, medications, and constant restrictions. But emerging research is revealing something fascinating. Certain bioactive compounds found in coffee interact directly with the biological systems that control blood sugar. We're talking about insulin signaling, liver glucose production, inflammation pathways, and even gut bacteria, the same core mechanisms targeted in modern metabolic treatments. As a diabetes specialist, I want to be very clear. Coffee is not a cure, and it does not replace medical therapy, but understanding how it affects your metabolism can give you an unexpected advantage, because blood sugar control isn't just about avoiding sugar, it's about how your body processes energy, hormones, and inflammation over time. The surprising part is that coffee can act in two completely opposite ways depending on how you consume it. Prepared intelligently, it may support insulin sensitivity and reduce glucose spikes. Used incorrectly, it can trigger hormonal stress responses and blood sugar elevations. So the question isn't simply whether coffee is healthy. The real question is whether you're using it in a way that works with your biology or against it. Once you understand the science behind this, your morning routine may never look the same again. What if one of the most powerful ways to improve your insulin response is already sitting in your kitchen? Most people think insulin resistance only changes with medication or extreme dieting, but emerging metabolic research shows certain bioactive compounds in coffee can directly influence how your cells respond to insulin signals. That matters because insulin sensitivity is the core problem in type 2 diabetes and prediabetes. When cells stop responding properly, glucose remains trapped in the bloodstream, forcing the pancreas to release more insulin, which gradually worsens metabolic damage. Coffee contains chlorogenic acids and polyphenols that appear to intervene at multiple points in this process. These compounds enhance glucose uptake into muscle cells, improve insulin receptor signaling, and reduce oxidative stress that interferes with metabolic pathways. In clinical observations, regular coffee consumption has been associated with improved insulin sensitivity markers, meaning the body requires less insulin to manage the same amount of glucose. That is a significant physiological advantage. Here's where it becomes even more interesting. Insulin resistance is strongly linked to chronic low-grade inflammation and cellular stress. Coffee antioxidants help reduce inflammatory molecules that block insulin signaling inside tissues. When inflammation decreases, insulin receptors function more efficiently, allowing glucose to enter cells instead of accumulating in the bloodstream. Some studies suggest that habitual coffee drinkers show better glucose metabolism even when other lifestyle factors are similar, indicating a direct biochemical influence rather than coincidence. This does not mean coffee replaces medical therapy, but it demonstrates that daily dietary compounds can act on the same biological systems targeted by medications. There is also a neurological component. Coffee influences hormones such as adiponectin, a protective metabolic hormone that improves insulin sensitivity and fat metabolism. Higher adiponectin levels are associated with lower diabetes risk, and certain coffee compounds appear to increase its activity. For individuals with early insulin resistance, this can translate into measurable improvements in fasting glucose and post-meal blood sugar control over time. The key insight is consistency. Metabolic improvements occur with regular exposure to these compounds, not occasional consumption. When used intelligently, coffee shifts from being just a stimulant to becoming a metabolic support tool, influencing cellular energy handling in ways that directly relate to blood sugar regulation. What if the biggest damage to your blood sugar isn't the sugar itself, but how fast it enters your bloodstream? Most glucose spikes happen within the first 30 to 60 minutes after eating, and those spikes are what drive insulin resistance, fat storage, and long-term metabolic dysfunction. This is where certain compounds in coffee become surprisingly important. Chlorogenic acids naturally present in coffee appear to slow the digestion and absorption of carbohydrates in the intestines. Instead of glucose flooding into the bloodstream rapidly, the release becomes more gradual and controlled. That difference in speed may sound small, but metabolically it is enormous. A slower glucose rise means the pancreas does not need to release large amounts of insulin at once, which reduces metabolic stress and helps maintain more stable energy levels. There is also evidence that coffee compounds inhibit enzymes involved in carbohydrate breakdown, particularly those that convert complex carbohydrates into absorbable sugars. When these enzymes are partially slowed, glucose enters circulation more steadily rather than in sharp peaks. For individuals with prediabetes or insulin resistance, controlling post-meal spikes is one of the most effective ways to protect pancreatic function and prevent progression toward type 2 diabetes. Many people focus only on fasting glucose numbers, but but post-meal spikes often cause the most long-term vascular and nerve damage. By moderating how quickly sugar appears in the bloodstream, coffee compounds may indirectly reduce these harmful fluctuations. Another layer involves gut hormones. Coffee appears to influence incretin hormones such as GLP-1, which help regulate insulin release and slow gastric emptying. When food leaves the stomach more slowly, glucose absorption becomes more controlled, leading to smoother blood sugar curves rather than sharp rises and crashes. This mechanism overlaps with how certain modern diabetes medications work, which explains why researchers are increasingly interested in dietary compounds that support similar pathways naturally. The effect is not identical to medication, but it operates within the same biological framework. Timing also matters. Consuming coffee around meals rather than on an empty stomach may enhance its ability to moderate glucose absorption, especially in individuals sensitive to blood sugar swings. Consistent daily intake appears more beneficial than occasional use because metabolic regulation depends on repeated exposure to these bioactive compounds. When viewed from a physiological perspective, coffee is not just influencing alertness or energy, it is interacting directly with digestive processes that determine how aggressively blood sugar rises after eating, which is one of the most critical factors in long-term metabolic health. What if your high morning blood sugar has less to do with what you ate last night and more to do with what your liver is doing while you sleep? Many people don't realize the liver is one of the largest contributors to elevated fasting glucose. Even when you're not eating, the liver continuously releases glucose into the bloodstream to maintain energy supply for the brain and vital organs. In individuals with insulin resistance or type 2 diabetes, this process becomes dysregulated. The liver produces more glucose than the body actually needs, leading to elevated fasting blood sugar levels, a phenomenon often called the dawn effect. Emerging research suggests that compounds found in coffee may help regulate this excessive glucose output, which is a critical target in diabetes management. Chlorogenic acids and other polyphenols appear to influence key enzymes involved in hepatic glucose production, particularly pathways related to gluconeogenesis. Gluconeogenesis is the metabolic process where the liver creates glucose from non-carbohydrate sources, such as amino acids and lactate. In insulin-resistant states, this pathway becomes overactive. Coffee compounds may reduce the activity of enzymes driving this process, leading to a more controlled release of glucose into circulation. This mechanism overlaps with the action of some first-line diabetes medications that also aim to suppress excessive liver glucose production. The implication is not that coffee replaces medication, but that it may support similar metabolic pathways in a complementary manner. Another important factor is liver fat. Accumulation of fat in liver cells, known as non-alcoholic fatty liver disease, is strongly associated with insulin resistance and elevated fasting glucose. Coffee consumption has been linked in multiple observational studies with lower liver fat accumulation and improved liver enzyme profiles. Antioxidants in coffee reduce oxidative stress and inflammation within liver tissue, which can improve insulin signaling in hepatic cells. When liver cells respond more effectively to insulin, they receive the signal to stop producing excess glucose, helping stabilize blood sugar levels overnight and into the morning hours. Hormonal regulation also plays a role. Coffee compounds may influence hormones involved in energy metabolism, including adiponectin and glucagon signaling, both of which affect how the liver manages glucose storage and release. Individuals with metabolic syndrome often have disrupted hormonal balance that promotes excessive glucose production. By improving metabolic signaling, coffee may contribute to more stable fasting glucose patterns over time. Consistent intake appears to be more beneficial than sporadic consumption because liver metabolism adapts gradually to repeated exposure to these bioactive compounds, potentially leading to measurable improvements in morning blood sugar control in some individuals. What if the real driver behind rising blood sugar isn't just carbohydrates or lack of exercise, but silent inflammation happening inside your cells every single day? Most people associate inflammation with pain or injury, but metabolic inflammation is different. It's low-grade, chronic, and often invisible, yet it directly interferes with how insulin works in the body. This hidden inflammation damages insulin receptors, disrupts cellular signaling, and forces the pancreas to produce more insulin just to maintain normal glucose levels. Over time, that constant strain accelerates insulin resistance and progression toward type 2 diabetes. Certain compounds in coffee, particularly polyphenols and antioxidants, appear to target this inflammatory process at a biochemical level, which is one reason researchers are paying increasing attention to coffee as a metabolic health tool. Oxidative stress plays a central role in insulin resistance. When excess free radicals accumulate inside tissues, they damage cellular structures and impair insulin signaling pathways. Coffee contains powerful antioxidants that neutralize these free radicals, reducing oxidative stress within muscle, liver, and fat cells. When oxidative stress decreases, insulin receptors function more efficiently, allowing glucose to move into cells instead of remaining in the bloodstream. This improvement in cellular responsiveness can translate into better blood sugar control without directly altering carbohydrate intake. For individuals with prediabetes or metabolic syndrome, reducing oxidative stress is one of the most effective strategies for slowing disease progression. There is also a strong connection between inflammation and fat tissue. Visceral fat, the fat stored around internal organs, releases inflammatory cytokines that worsen insulin resistance. These inflammatory molecules interfere with insulin signaling and promote further fat accumulation, creating a vicious metabolic cycle. Coffee polyphenols have been shown to reduce levels of certain inflammatory markers, including C-reactive protein and interleukin-6, which are associated with metabolic disease risk. By lowering inflammatory signaling, coffee may help break part of this cycle, improving the body's ability to regulate glucose and store energy more efficiently. Another important dimension involves the immune system. Chronic metabolic inflammation activates immune pathways that were originally designed to fight infections, but become harmful when continuously stimulated by poor diet, excess weight, and sedentary behavior. Coffee compounds appear to modulate immune cell activity, reducing pro-inflammatory responses while supporting protective antioxidant defenses. This immune modulation is significant because insulin resistance is increasingly understood as an immune metabolic disorder rather than purely a hormonal problem. Addressing inflammation therefore targets one of the root causes rather than just the symptoms of elevated blood sugar. Hormonal balance is also influenced by inflammatory status. Inflammation disrupts hormones involved in appetite, fat storage, and glucose regulation, including leptin and adiponectin. Coffee consumption has been associated with improved adiponectin levels, a hormone that enhances insulin sensitivity and reduces inflammation simultaneously. Higher adiponectin activity supports better glucose uptake in muscles and improved fat metabolism, creating a more favorable metabolic environment. When inflammation decreases and protective hormones increase, the body becomes more responsive to insulin, reducing the amount needed to control blood sugar. What makes this particularly compelling is that these effects appear to accumulate over time with consistent intake rather than producing immediate dramatic changes. Chronic diseases develop slowly, and metabolic improvements also occur gradually as cellular environments shift toward lower oxidative stress and inflammation. For many individuals, daily habits that reduce inflammatory burden can significantly influence long-term diabetes risk and progression. Coffee, when consumed without excessive sugar or high-calorie additives, becomes more than a stimulant. It acts as a source of bioactive compounds interacting with inflammatory pathways that directly affect insulin function. The metabolic impact depends on overall lifestyle context, including diet quality, sleep, physical activity, and body composition, but the anti-inflammatory properties of coffee provide an additional layer of support for improving glucose regulation in individuals experiencing insulin resistance or metabolic dysfunction. What if improving your blood sugar has less to do with willpower and more to do with the trillions of bacteria living inside your gut? This idea surprises many people, but modern metabolic science is increasingly clear. The gut microbiome plays a central role in insulin sensitivity, inflammation, appetite regulation, and glucose metabolism. When the balance of gut bacteria is healthy, the body processes carbohydrates more efficiently, inflammation stays lower, and insulin works more effectively. When that balance is disrupted, metabolic problems often follow. Coffee contains polyphenols and soluble compounds that act almost like fuel for beneficial gut bacteria, which may explain part of its protective effect against type 2 diabetes. Unlike simple nutrients that are absorbed quickly, many coffee polyphenols reach the colon relatively intact, where gut microbes break them down into smaller bioactive molecules. These metabolites can influence metabolic pathways throughout the body, including liver glucose production, fat storage, and insulin signaling. Beneficial bacteria produce short-chain fatty acids such as butyrate, acetate, and propionate during this process. These compounds strengthen the intestinal barrier, reduce systemic inflammation, and improve insulin sensitivity in tissues like muscle and liver. A stronger gut barrier also prevents harmful bacterial toxins from entering circulation, which is important because these toxins can trigger inflammatory responses that worsen insulin resistance. Another fascinating aspect is how coffee consumption appears to increase microbial diversity. Greater diversity in gut bacteria is associated with better metabolic health, lower obesity risk, and improved glucose regulation. Certain bacterial strains linked to metabolic benefits, including those involved in fiber fermentation and anti-inflammatory activity, seem to thrive when exposed to coffee compounds. This microbial shift may help explain why habitual coffee drinkers often show lower diabetes risk, even when other dietary factors are similar. The gut essentially becomes more metabolically supportive, enhancing the body's ability to manage blood sugar. Gut hormones also connect directly to this process. Beneficial microbes stimulate the release of hormones such as GLP-1 and peptide YY, which regulate appetite, slow gastric emptying, and improve insulin secretion after meals. These hormones are so important that modern diabetes medications are designed to mimic or enhance their effects. When coffee supports microbial populations that naturally stimulate these hormones, it creates a physiological environment that favors stable blood sugar and reduced cravings. Improved appetite regulation can indirectly support weight management, which further enhances insulin sensitivity and glucose control. There is also growing evidence that disruptions in gut microbiota contribute to cravings for high-sugar foods, creating a cycle that worsens metabolic health. By supporting beneficial bacterial growth, coffee polyphenols may help reduce these cravings through improved hormonal signaling and neurotransmitter interactions between the gut and brain. This gut-brain connection influences hunger perception, mood, and energy regulation, all of which affect dietary behavior and blood sugar outcomes. The metabolic impact therefore extends beyond digestion into neurological regulation of appetite and motivation. Consistency appears to be critical because microbial populations adapt gradually based on repeated dietary exposure. Occasional coffee intake may not produce significant microbial changes, but regular consumption can shift the ecosystem toward a more beneficial composition over time. The preparation method also matters, as unfiltered coffee retains more bioactive compounds, although individual tolerance varies. When combined with a fiber-rich diet, adequate sleep, and physical activity, coffee's influence on the gut microbiome may become part of a broader metabolic improvement strategy that supports better insulin function and glucose regulation through interconnected biological pathways. What if the difference between coffee helping your blood sugar and harming it comes down to just a few small choices you make in seconds? Many people assume coffee is automatically beneficial because of the research around metabolic health, but the reality is more nuanced. Coffee can support glucose control when consumed correctly, yet it can also trigger blood sugar spikes, hormonal stress responses, and excess calorie intake when prepared improperly. The preparation method, additives, timing, and individual physiology all determine whether coffee becomes a metabolic ally or a hidden problem. One of the most significant factors is added sugar. Flavored syrups, sweetened creamers, and sugar itself transform coffee from a low-calorie beverage into a rapid glucose load. Liquid sugars are absorbed quickly, producing sharp blood sugar spikes and large insulin responses. These spikes contribute to insulin resistance over time, especially when repeated daily. Even drinks marketed as specialty coffee beverages often contain sugar amounts comparable to desserts. For individuals concerned about metabolic health, removing added sugar is one of the most impactful changes. Natural spices such as cinnamon or unsweetened cocoa can provide flavor without disrupting glucose stability. Fat content also plays a role. While small amounts of milk or cream are generally well tolerated, excessive high-calorie additions can increase total energy intake and contribute to weight gain if not balanced within overall nutrition. Body fat, particularly visceral fat, strongly influences insulin resistance, meaning caloric balance still matters. Coffee itself is not the issue. The surrounding ingredients determine metabolic impact. Choosing unsweetened versions allows the bioactive compounds to work without being overshadowed by excess calories. Caffeine sensitivity is another important variable. In some individuals, caffeine stimulates the release of stress hormones such as cortisol and adrenaline. These hormones temporarily increase blood sugar by signaling the liver to release glucose into the bloodstream. People with higher stress reactivity or poor sleep may experience noticeable glucose elevations after coffee. Monitoring individual response with glucose testing can reveal whether caffeine is helpful or counterproductive. Interestingly, decaffeinated coffee still contains many beneficial polyphenols, meaning metabolic advantages may remain even without caffeine stimulation. Timing influences outcomes as well. Drinking coffee on an empty stomach early in the morning can amplify cortisol release in sensitive individuals, potentially increasing insulin resistance temporarily. Consuming coffee with or after food often produces a more stable metabolic response because nutrients buffer hormonal fluctuations. Late-day caffeine intake may disrupt sleep quality, and sleep deprivation itself significantly worsens insulin sensitivity. Poor sleep increases hunger hormones, reduces glucose tolerance, and raises fasting blood sugar the following day. Managing caffeine timing therefore becomes part of overall metabolic regulation rather than just a matter of preference. Frequency and dosage matter too. Moderate consumption, typically 2 to 3 cups per day, appears most beneficial in research settings. Excessive intake may increase anxiety, heart rate, and sleep disruption, indirectly worsening metabolic health. Balance allows beneficial compounds to accumulate without overstimulating the nervous system. Hydration should also be considered, as dehydration can influence blood glucose concentration and energy regulation. Individual variability remains central. Genetics, gut microbiome composition, hormonal status, medications, and existing metabolic conditions all influence how a person responds to coffee. Some individuals experience improved glucose control, while others notice minimal change or temporary elevations. Personalized monitoring removes uncertainty and allows coffee consumption to be adjusted according to measurable outcomes rather than assumptions. When consumed thoughtfully, minimizing sugar, managing timing, respecting caffeine sensitivity, and integrating it into a balanced lifestyle, coffee shifts from being a simple habit to a targeted metabolic tool that interacts with multiple physiological systems affecting blood sugar regulation.